Hi, Mr. Brian.
Hello.
Hi, my name is Courtney. I'll be your nurse today. How are you?
Good.
Good. So today we're going to be looking at your musculoskeletal system, that's your muscles, and at some of your nerves and testing them, okay?
Okay.
Alrighty, so have you been having any stiffness or limitations with moving your joints?
No.
Okay, how about when you're walking?
No.
Alright. Have you been noticing any swelling or redness or pain to any of your muscles?
No.
Have you been having any muscle spasms?
No.
Okay. Have you been having any back pain?
No.
Alright, good. And I know that we have previously talked about you not having any seizures or convulsions, no pain of course, and you have no falls or problems with your walking, no weakness, no tremors. And then of course you said that you don't have any history of trauma, deformities, or any congenital abnormalities.
Right.
Alright, so everything looks clear with the neurological system so far. I noticed while you were walking up the hallway for me that your extremities are bilaterally symmetrical in length, circumference, alignment, and there are no skin folds present anywhere.
Good.
While previously inspecting your back, I found that the shoulders were even in contour, your scapula were level, and the iliac crests and your hips are within alignment, which is good. And notice there are no deformities, swelling, or masses, and the skin color is appropriate both front to back.
Good.
So I'm going to go from head to toe inspecting your joints first, okay?
Okay.
So I'm going to have you lean forward to me. I'm going to look at your temporomandibular joint here in your jaw. Open and close your mouth. Alright. Now protrude it out towards me. And bring it back. Okay. I didn't notice any clicking or popping. Did you have any pain while doing that?
No.
Okay. I need you to do it from side to side too. Any pain with that?
No.
No clicking or popping. Nothing there either.
No.
And I'm going to feel you one more time. I want you to clench your teeth together. Your muscles are very strong, equally strong on each side there. I noticed no swelling or warmness either. Good. And I'm going to feel the cervical spine. Feel the sternocleidomastoid right here. And the trapezius in the back. So they have good muscle tone. They're symmetric in size. There's no palpable tenderness. Any tenderness whenever I'm...
No.
Okay, but they're similar in size. And I didn't notice any muscle spasms, or no swelling. I didn't notice any redness. And you said there was no pain. I'm going to have you move your head side to side. There you go. Take your chin to your chest. And now towards the ceiling. Okay, and now do your chin to your each side. Okay, any pain?
No.
Doing that? Okay, good. The next thing that we need to do is look at your shoulders. So I'm going to have you stand up for me. Again, like I said, the size and contours of your shoulders are symmetrical. I don't notice any masses, no redness back here. Are you having any pain whenever I'm palpating?
No.
Okay, good. Can I have you to shrug your shoulders for me? Okay, can you turn towards me? And shrug your shoulders again. Just looking at your shoulder girdle muscles. Alright, good. Now I'm going to have you to extend your arms out towards me. And don't let me push down. And don't let me push up. Good, you're bilaterally strong in each arm, on each side. Now I'm going to have you to abduct your arm across your body. And now take it out and out. That's adduction. So adduction, abduction. Okay?
Okay.
The next thing that we're going to do is I'm going to have you reach out and back behind your back. And do that on the other side as well. Any pain with that?
No.
Alright, now reach up and behind your head with each arm. Behind the head. There you go. And I'll do it with the other arm. Any pain with that?
No.
Alright, good. I'm going to have you turn around one more time for me. I'm going to look at the curvature in your spine back here, your thoracic and lumbar spine. Can you bend over and touch your toes? Any pain?
No.
Okay, and come back towards me, slowly. Alrighty. So, the curve of the thoracic spine is convex, and the curve of the lumbar spine is concave, and there's no muscle spasms, and are you having any tenderness while I'm back here?
No.
Okay. Alrighty. So you can go ahead and have a seat. Now I'm going to look at your elbows. Just relax here for me. Inspecting them, there are no nodules. The olecranon process, the exterior surface of the ulna, the medial and lateral epicondyles. I don't see, there's no swelling or thickening of the synovial membrane. Are you tender anywhere that I'm
No.
feeling under there?
No.
Okay, can I see your other arm? Again, no nodules, no swelling, no tenderness.
No.
And there's no thickening of the synovial membrane on this side either. I'm going to have you to flex each one. So flex one, extend it out. And I'll flex the other one and extend it out. Okay, good. Now I'm going to have you to lay your hands with your palms down and move your hand palm up. So go like, yep. Any pain while doing that?
No.
Good. Alright. The next thing I'm going to look at here is your hands and your wrists. So I'm going to look at your palms first here. So each of these palms has a central depression with a prominent thenar entrance in the thumb side of the hand and a less prominent rounded eminence on the little finger side of it. The fingers fully extend and they're aligned with the forearm. There are 5 digits on each hand, 10 digits all total. Each of those digits are complete. Just going to feel around your joints here. So these joints here are the interpharyngeal joints. These are the metacarpophalangeal joints. And these are the radiocarpal groove in the wrist. Okay, now I'm going to ask you to bend your fingers forward at the metapharyngeal joint. So we've done them down. Now I want you to stretch the fingers like they were back out at the knuckle. Then I want you to bring them up a little bit. Extend up. Alright, good. Now I want you to touch the thumb to each fingertip. Alright, good. Make a fist for me. Those are equal. Strong. Spread your fingers apart and then touch them back together. Good. And now I want you to bend the hand of your wrist up and down. Bend your wrist up and down. There you go. Very good. Do you have any pain moving any of those joints?
No.
Okay. And so now we're going to move to your hips. I want you to, can you have a lay down for me here? Palpate your hips here. So your hips are symmetrical, and while you're standing, I happen to see that the gluteal folds were also symmetrical. I'm palpating your hips and your pelvis. There's no instability. You having any tenderness with me doing this?
No.
And I didn't notice any crepitus. Now I'm going to have you to raise your leg with your knee extended above your body, one leg at a time. Very good. No crepitus. Any pain?
No.
Okay. I want you to raise one knee to your chest while keeping your other one straight. Raise your knee to your chest. There you go. Bring your knee to your chest. And then back out. Yeah. And I'll do the other one. Good. Now I'm going to have you to bring your leg out towards me like you're swinging a pendulum. and move it back towards your body. Try your best with your other one there. Alright. Now I'm going to have you to flex the knee, keeping your foot on the table. So flex your knee up on our couch here. And I want you to rotate the leg with the flex knee towards the other leg. So go towards it and go back, come back towards me. Alright, don't let me push down. Good. Alright, now let's do it with the opposite side. Knee up, swing it towards me, swing it back out, and don't let it push. Good. Alright, now we're going to do, we're going to bring your leg back up like you was, except you're going to lay your foot across your opposite knee. And you're going to bring this down as far as you can. Don't let me push it down. Good. Now let's do it with the other side. Don't let me push it down. Good. So you're nice and equal and strengthen both of your legs and knees there and your hips.
Good.
I'm going to look more into your legs and your knees now, especially at special parts of your knees. So, feeling around here, I feel the tibial tuberosity, the medial and lateral tibial condyles, the medial and lateral epicondyles, and the abductor of the femur. And I also feel your patella. Whenever you were sitting up, I noticed the angle between your femur and your tibia is less than 15 degrees, which is good, it's the normal. And I also noticed while I was palpating there that there was no swelling or tenderness, and neither was it on the popliteal space behind your knee. So I'm going to have you stand up one more time for me. And you're going to bring your leg back behind you, and I'll swing it forward. Alright, good. Now do the opposite leg. Good. Alrighty. And now you can have a seat. You can sit up. And as you were also just standing there for me, I noticed that your feet were in alignment with your tibias. Your weight bearing is in the midline of your foot, which seemed to flatten out as you stood. The toes were straight forward. They're flat and in alignment. There are 5 complete digits on each foot, 10 total, and they're of appropriate size. I'm going to feel your Achilles tendon behind your foot here. Okay. Alrighty, and I'm going to take a look at your foot. Can I see this? So, that the phalanges, the metatarsals, and the tarsals are in your ankle. I want you to point your foot. You have your foot pointing towards the ceiling at the moment. Can you point it towards the floor? Good. Now I need you to bend your foot at the ankle, turning the sole inside. Like if you were standing like this. Yeah. Yep, flexing towards and out, good. Now I want you to rotate your ankle. Like you were going in like you were moving the foot. There you go. Good. Any pain when doing that?
No.
Alright. Let's do the same with this one. So you're already pointing it towards the ceiling. I want you to try to point it towards the floor. Now we're going to bend the foot at the ankle inwards. Sway it. And now take it outwards. Alright. Now we're going to rotate the ankle in a whole circle. Good. And there's no pain. I don't notice any swelling.
No.
No swelling down here. And no crepitus whenever he was moving his ankle or any of his bones in his foot. Good. So now we're going to test some of your senses. We're going to go with the first we looked at the olfactory. We're going to identify some aromatic odors. We're going to do one area at a time. You're going to close each one of them, and you're going to sniff a fragrance that I have, and then at the end you're going to tell me what the fragrance is.
Okay.
Okay? So I want you to come towards me, close your eyes. Yep. Close one of your nares. And sniff. Breathe a couple times. Now close your other one. Go ahead and sniff it again. Okay, you can breathe normally a couple times. Alright, can you tell me what you smell?
Orange.
Good job, yes. I'm gonna wait a few more seconds here. And then we're gonna test another fragrance.
Okay.
Okay, go ahead and close your eyes again. Sniff in. Breathe a couple times. Close your other nary. Breathe in. What do you think you smell?
Peppermint.
Yes, very good. Alrighty. So the next one that we are going to talk about is the optic nerve, and we actually already did that. We did when we tested your vision with your Snellen chart. You were 20/40 in your left eye and 20/20 in your right eye.
Mm-hmm.
And that was very good.
Okay.
We also talked about your oculomotor, your trochlear, and your trigeminal nerves. With your oculomotor, your eyelids were not drooping, and they're not drooping now. With your trochlear, we talked about the movement of your eyes downward and inward, which they do fine.
Right.
And with your trigeminal, we discussed that there was no muscle atrophy or tremors in your jaw muscles. The jaw is symmetrical and there are no fasciculations there.
Good.
I'm going to test you for a dull sensation or sharp sensation over your face.
Okay.
You're going to have to close your eyes for this. So let me know if you feel a dull sensation or a sharp sensation.
Okay. Dull. Sharp. Dull. Sharp.
Alright, very good. So, and now we're going to talk about your abducens. That's basically your pupils. With the pen light, they were equal and reactive to light, which is what we wanted them to be like.
Okay.
And they accommodated appropriately. And we did the 6 cardinal signs of the gaze, and you did well with that. So now we're going to talk about your facial nerve, which is facial nerve number 7. I'm going to have you raise your eyebrows, and I'm going to have you frown. Puff out your cheeks. Smile. Show your teeth. Good. And wrinkle your forehead. Good. So that's all up to the facial nerve to do that for you. You did it very well. The next one that we're going to test is the acoustic nerve, and that's that was also with the hearing tests, and using the Romberg test we can see how well that your balance is coordinated with your cerebellum and your brain.
Okay.
So I'm going to have you to stand with your feet together and your arms close to your sides with your eyes closed.
Okay.
So stand for me. Alright, good. You can sit back down. There's a slight swing, and that's pretty good. You have good motion there, not moving around too much. The next thing that we tested was your gag reflex, and we also tested the glossopharyngeal nerve sensation with that. Along with testing your gag reflex, we also tested the vagus nerve. We found that the soft palate to be symmetrical, the uvula stayed midline, and when we tested your thyroid, you swallowed easily with no water coming out of your nose. When we examined your muscles in your neck, the trapezius and the sternocleidomastoid, we were testing your spinal accessory nerves, another one of your nerves. And the final one that we're going to do is the hypoglossal. And I'm going to just look at your tongue. Open. Open. Just keep your mouth. Okay, now bring it back out towards me. Alright, good. So I didn't see any fasciculations, no asymmetry or atrophy or any deviation from midline.
Good.
Everything looked normal from that side.
Good.
Okay. The next thing that we're going to do is we're going to evaluate the coordination and of your fine motor skills by rapid rhythmic alternating movements. So I'm going to do what you're doing right now. Start patting your knees. Now start alternating back and forth. Yep. Can you get faster? There you go. Good job. Alright, so that was a good smooth movement. Pass that test. Alright, we already did the Romberg test. The next thing that we're going to do is we're going to, I looked at your posture while you were walking. Your gait while walking was nice and smooth, regular in rhythm and symmetrical on each side of your arms. They swing symmetrically from side to side, which is how it should be. I'm going to do a vibratory response test with you using a tuning fork over your joints or bony prominences on your upper and lower extremity. Have you lay down for me? I'm just going to have you close your eyes one more time, and I want you to tell me if you feel a buzzing or tinglings and where you feel it at.
Okay. Ankle. Toe. Kneecap.
Do you feel buzzing or do you feel tingling?
Feel buzzing.
Okay.
Hand. Elbow.
Good. Alrighty. Now you can open your eyes. We're going to evaluate the perception of your position sense with the movement of your greater toes or a finger on each of your hands. So I'm going to take one of your joints here in your hand. Close your eyes. We'll pick one. Tell me what I'm doing. Am I bringing it up or down?
Up. Down.
Okay.
Down. Up.
Alright.
Up.
Alright. Very good. Now we're going to do, I'm going to assess the ability to identify some of the familiar objects by touch and manipulation.
Okay.
So again, close your eyes for me. And I want you to tell me what this object is. It's something that you use every day.
Coin.
Yep. Can you tell me maybe what kind it is? I'm just curious.
Quarter.
Yep. Good job. And now I'm going to draw a letter on your hand on the palm side, and I want you to tell me what it is.
A.
Okay. Can I see your other hand? Close your eyes.
E.
Good job. And now we're going to assess the ability to identify the body on the area when I touch you. So when I touch you somewhere, I want you to tell me where I'm touching you at.
Okay. Hand. Kneecap. Foot. Shoulder.
Good. Alright. And now we need to do your superficial and your deep tendon reflexes. So if you can sit up towards me one more time. Alright. I'm going to test your abdominal reflexes. Can you please lay down? So now we're going to do your superficial and deep tendon reflexes here. I'm going to lightly stroke each side of your belly here. and I can see your umbilicus slightly moving, which is really good. We tested the chromatic reflex already when I stroked the inner thigh here with that, and it was good because we saw each testicle and the scrotum rise on each side that it was supposed to be on.
Yes.
Now I'm going to test your plantar reflex, so I'm going to stroke from the heel to the ball. So I see plantar reflex. I don't see any dorsiflexion or any fanning of the toes. Again, same thing, plantar flexion and dorsiflexion or a fanning of the toes. Mainly, if you see a fanning of the toes, is mainly in an infant, so that's good. Next thing I need to do is I'm going to look at your biceps reflex. Can you sit up for me? Okay, I need your elbow at a 45-degree angle. There you go. Hold the thumb at the bend here. I'm just going to tap with it. Alright. And I've seen contraction of the biceps muscle. It was visible. I kind of felt it with palpable flexion with that. I'm going to look at your brachioradial reflex. Hold your hand here. And I'm going to lightly tap above your wrist. Good. And then I've seen pronation of the forearm and flexion of the elbow just a slight bit there. I'm going to do your triceps reflex. I'm going to flex your arm up in a 90-degree angle outward, and I'm going to hold it up like that. And I'm going to knock a little bit here. Okay, and that's when you see the contraction of the quadriceps muscle, which causes contraction of the triceps muscle was visible there. Just talking about my lower leg. Alright, let's do it on the other side now. Biceps reflex here. Again, I'm seeing the contraction there of the bicep muscle. Hold your radial out. And again, there was the pronation of the forearm and the flexion of the elbow a little bit there. Now we're going to hold your arm out again like this. And then again, you can see that there was the contraction of the triceps within the arm. Very good. Okay. So now I'm going to look at your patellar reflex. I need to see your ankles here. So I'm going to have you to flex your knee 90 degrees away from your bed here. Just keep it away from the side of the couch. You got that. Try the other one. So there I saw that the contraction of the quadriceps muscles and the extension of the lower leg, which is what we needed to see. The Achilles tendon, I'm going to look down here for it again. And then there is a contraction of the gastrocnemius muscle, causes plantar flexion of the foot. And again, same plantar flexion of the foot. Good. And now I'm going to look for inclinus in your ankles, which I did not notice. And there was no rhythmic osculating movements that were palpated. Okay. It looks very good. The doctor will be in soon to see you, okay?
Thank you.
You're welcome.